Dr. Veena Vangari, as you see, she is very experienced nurse executive. She has over 20 plus years of leadership experience in nursing, hospital administration, chief nurse, rehabilitation service. She works with Veterans Affairs, Palo Alto healthcare systems. She also has very diverse credentials. She has BSN from SNDT Women's University, Doctors of Nursing Practice from Baylor University, MBA, then Masters in Sociology and Postgraduate Diploma in Hospital Management. She is certified healthcare leader, certified in rehabilitation nursing, called as CRRN, healthcare accreditation, risk compliance governance, and healthcare quality. Professional leadership, she is also secretary on the Emergency Medical Care Committee, San Mateo County, board member, Sigma Theta Taus Omicron Omega chapter. She is also a nursing advocate, champions health awareness and empowers nurses to drive change within and beyond hospital settings. Also community engagement as executive vice president. The Veena is a nursing association for the Bay Area, chapter of the National Nursing Association, also fostering culturally competent care and nurse empowerment. So as you see, it took me a while to just to go through all of her credentials, and they are not all represented. We are very thrilled to have her join us on this panel, and I welcome Dr. Veena Vangari.
First of all, I want to say thank you to Mr. Som and Baina, as well as all the others who have worked behind the scene to make this happen, and all the people who are joining. I really appreciate the time. And as we did a little poll, I was just observing that 50% of the people actually are beginners. I'm going to go ahead and share my screen. I'm not going to go ahead and discuss more about what we're going to talk, but I want to do a little disclaimer. I have nothing to disclose. And whatever conversation we are going to talk or discuss, it is basically health awareness, education, and giving more of the information to everybody. So there is nothing that we are. If you have some medical emergency or issues, please contact your PCP, or if you have emergencies, contact 911. So just want to make sure that I discuss that before we go ahead with the conversation. So, as the topic has been discussed with everybody, we are going to talk about nursing services. It's going to be very preliminary, as this is the first interaction with the community, and it's a collaboration between CWC and Bena. What we are trying to do today is myself and Dr. Sejal. We are trying to connect with the community and let you guys know what nursing was, the role of nursing, what we are able to support, what is our role actually in the community as well as in the hospital, so that everybody just understands what we are able to do and how we can support the community in different ways. So these are going to be my objectives for today's conversation. I'm going to talk about early recognition of healthcare needs, adopting healthy living practices, understanding chronic disease management, and self advocacy. From my understanding, today's conversation is really geared towards the elder track, and majority of our elder population really are the struggling with chronic disease conditions like asthma, diabetes, hypertension, arthritis, and so that's why the most of the conversation is going to be geared towards that, as well as certain things with the different medication management, as well as making sure that everybody knows how to advocate for themselves and be able to discuss their needs, so that everybody is able to kind of speak for themselves, make their needs known, and have the understanding. And I think the process will give you a little bit of understanding as to what tools you can utilize so that you are able to be heard and where to find that information. So the first thing we're going to talk about is health monitoring and assessment. The most important thing is, as we are aging, it's not just for people who are older but even younger people. I think most important thing is to understand what is the how to recognize the early signs and symptoms of diseases. Like, mostly we see a lot of things for monitoring and assessment. Now we have a lot of wearable devices, like you have iPhone, iWatch, that helps you understand, like, your heart rates, your arrhythmias, if you're hypertensive, different movements, your activities when you're walking. It gives you a count. When you're sleeping, it gives you how many hours you're sleeping. This just helps you understand what is your baseline health data. And everybody must have seen that people use patch called as Dexcom, that helps people understand where is your blood sugar levels. And though a lot of diabetics are using it, but as as you're seeing in this age, a lot of youngsters are also using this, so that they want to see how healthy they are eating, how much carbs they are eating, how their blood sugar goes up and down. So it's very helpful for people to really understand in an early time where their blood sugars are. The next is about the hearing loss, making sure that early you understand what's going on with your hearing loss, because sometimes the hearing loss can also be looked like if people are having dementia, because you really need to understand the difference between, is somebody having difficulty in hearing, or are they really just having difficulty in understanding. So making sure that there is a regular checkup to understand what's going on. And the last but not the least is about the other things is about the dementia. And this is something really understanding, knowing that people are actually moving towards poor coordination, poor collaboration, poor judgment skills, and just understanding that in an early phases is also important. The other most common thing is about the joint pain and falls. You see people having a lot of joint pains, complaining of swelling, complaining of difficulty walking. Those are the things that you have to really watch to see if they are moving into some bone disorders and arthritis, so that we are able to kind of uh, understand what's going on in their life. And this would be something that will lead to different uh, things that will be causing. And I think the more monitoring is done, it will help people to actually prevent diseases, so that you're not actually going into another situation. All the early signs and symptoms. We also want to make sure that you're able to educate yourself as well as your family members on how can you promote the health. I think the first picture that you see over here is really, self-care is very important. Making sure that this picture really reminds us that when you have something, you really have to pour in yourself. And I think this example has become very common now. When in the flight you say that mask yourself before you take care of somebody else. So it's really important that each and every person, whether they're young, adult, or elderly, take care of themselves, so that if you are able to making sure that you are healthy to continue your journey. Healthy diet, which is very common these days, to ensure I'm also making sure that I'm watching the time, that I'm not boring everybody. 50% of your vegetables, 25% of your protein, and 25% of the carbohydrates. Looking at your plate, what you're eating, and making sure that you're eating in a appropriate manner, and having those rest periods. The sleep, making sure that you're resting well, you're exercising well, appropriately, and you know positive thinking, positively about yourself, having more interaction with people. I put a sign over here of meditation. Everybody has different faith and different spiritual feelings, and how they interact with the universe, Almighty, God. I think that's really important for people to get connected, so they're able to feel in themselves more empowered. So it's very important for them to have that connection, to have that well-being. The other thing is vaccination, and I won't go into detail because my colleague Dr. Sejal is going to discuss more about that. And then, but that's very important for us to make sure that you are actually keeping yourself covered from all the different various diseases. Social interaction, though we say that social interaction is basically talking to people, connecting with people physically, is definitely most important thing. But also there are apps, there is Facebooks, there is uh, uh, chats and other things. It connects people so that you're mentally really feeling that somebody loves you, somebody takes care of you. It's also extremely important. The other thing that we are going to talk about is the chronic disease. So if you've taken care of it, life happens, people still fall sick. You've taken care of everything, but as the body ages, our metabolic rate goes down, your health deteriorates, and things happen. So there are so many conditions that as you age, there's high blood pressure, there's high cholesterol, there's arthritis, coronary artery disease. So all these conditions come into people's life. So most important thing is like uh, when you are in these situations, I think as we are just going through this process, understanding that you have educated yourself to educate, understand management of that condition is important, because you cannot just say that yes, we did prevention, but things happen in life. People do fall sick, people do have arthritis, they have depression, they have dementia, they have COPD, they have heart failure. How do you kind of continue with your life, take good care of yourself? And I wouldn't say you can reverse. There are times that you can reverse, but you also learn to manage your life and still live a very uh, productive life, so that you're able to connect with your community and your family, and are able to be more productive in your life. The most important factors when you're dealing with diseases is ensuring that you're having your regular checkups. Commonly, it's annual checkup, but if you are sick, then you need to do more often checkups to make sure that you're connecting with your uh, practitioner, checking with them, understanding what's going on. The bigger concern is when you are sick and when you're having so many medications. Polypharmacy is a big topic. We can actually talk about that an hour, but it's really important to make sure what time you're taking your medications, who is helping you take the medications. As you know, when people are aging, they have sometimes difficulty in hearing, they sometimes have low vision, and then all these actually adds up. And sometimes instead of taking one dose, they might take two doses, or they might take too many doses early in the time. So all this adds up. And the other most important thing is the interaction with the medications. So when medications interact with each other, simple thing like green tea, and if you are on a blood thinning medications, what happens is they interact. The medication for warfarin, it actually does not have a better action, so it does not, anticoagulation doesn't work very well. So these simple things can actually cause more problems. If you are on a paid medication, and if you are going for any surgical procedures, if you are on warfarin, and if you are on pain medications, then again, like an Advil or other things, and warfarin can again have more there is more possibility for you to have more bleeding. So these are things that need to make sure that you connect with your physician, and have them review your medications to ensure that you're doing the right thing. There is a little video that I would like to show before we move on. So just wanted to give everybody an idea about the medication management, and ensure that once once people are in medications, and that they're on several medications, ensuring that the family members or the caregivers have the ability to work with the senior members or the elders to ensure that they are able to um, put the medications correctly, are storing the medications in the right manner, are able to actually keep a log of the medications when required, and also having some kind of tips to ensure that they are, when they're going from one location, like from the physician's office to the doctor's to a different doctor, what medications they're taking, if they're going for a procedure, if they are on certain medications, and if they have told to stop certain medications. And after the procedures, some of the elders are actually transferred out to a nursing home. That's where actually the gap occurs and the medications are missed, and sometimes some of the symptoms just come back. So I think it's very crucial for the family members also to be on top of the medication list and have a medication list available and ready, and keep it updating it regularly after a physician's visit is over. The next, we're going to talk about advocacy and coordination of care. As we just talked about recently about the medications, patients and family members are really critical in taking it, in informing what's going on. Like the patient as well, I mean the elders. Being a nurse, I always talk about patient. I think I'm talking about our family members, our parents, our grandparents, as well as anybody in the community. They need to speak up for themselves, but there are sometimes barriers. It could be a barrier with the language. So we also need to know that there are translation services available to ensure that they what they speak is exactly converted, because sometimes how people speak is not exactly translated correctly. So having that ability to ask for translation services, so there should be some ability for people to say, I don't speak the language, can I be able to get the language service line available? So those things are available for patients. The other thing is also explaining what medications they are on, where is the problem, what are they suffering from, and also having their rights, because because all the people have their own rights. If they prefer not to have a treatment from a particular provider, they can say that I do not wish, and they can actually move to another provider. So making sure that people know about that. The advice nurse, that's where I think the nurses come into play. Everybody has a insurance card. Most of the insurance companies provide free advice nurse line available. So calling them, asking for advice, but there are also advice nurses in the physician's office, in the hospital, to ask questions, to support them. And most of the nurses or the care coordination nurses or case management nurses are the ones who are actually the I would say they are kind of the center of ensuring that the patient is taken care of, or the elders or the family member is taken care of in the hospital and around, like ensuring that the insurances are taken care of, they're getting the services, they're being provided, medications are provided to them, and also are they in the right level of care? They need to be at home, do they need to be in assisted living, do they need to be getting home care services? So those are the things that are important while the person gets into transition. So this little icon over here shows that people can go from home to the hospital, to the nursing home, and to the clinic, and that these things go back and forth. So ensuring that there is people understand what is transition of care and what levels of care. If they're really acutely ill, they go to the hospital. If they're not, then it's nursing home, or sometimes just a clinic visit, and they can come back and take care and be taken care of at home. This is called the elder care locator, and I think Pallavi will put the link in the chat. And the most important thing is, I think everybody should know that there is a phone number available, there is a locator, and if you open the link and you just put your zip code number or a city, it actually comes up with all the resources available. Resources like what services are available in your location where you're living, what kind of healthcare resources are there, including resources for living, as well as anything that you're looking forward to support your elders. And it's not just for elders, anybody else. So I think it's a very important resource. It's a tool. If you don't take anything out of this conversation, I think this will be a great tool to utilize once you are finished, and you can always have that link and utilize that. Ombudsman, this is an organization that's a federally mandated organization that's that takes care and is helping anybody who would feel that they're being abused physically, financially, or any other way. You can call them, and they will be coming and reviewing your cases. I think those are the things that are important for all our elders to know and explain. The last, I wanted to just go over a few things. Not everybody would like to hear more about it, but supportive care. Some of the disease conditions like cancer and other things, there are cure, but there are certain things that that end up into something not always that we would like the way to end. And making sure that we would like our parents, our older adults, and our grandparents to have some peaceful and joyful time as they are actually transitioning into that other phase of their life. So making sure that there is home care services available for them, that they can stay at home, enjoy with time with their loved ones, and still be available at home. Support group. Support group is something that can be friends, can be family members, as well as others who are going through the same kind of conditions, like the people who have had cancers, or somebody who had a major surgery. You actually connect with them. Counseling services and hospice, again, this is the end that nobody would really like to talk about, but there are that is basically a quality of life that when people feel that this is the way that I would like to end my life. It's something that you're actually working with them to ensure that it's a way of just making sure that they're comfortable as they are actually entering into more painful. So if there's pain, they'll give pain medications. If they're suffering from difficulty in sleeping, they'll provide them that kind of support. So I think those are the services that are provided. Just before ending, there's also something I want to make sure that everybody knows is called in-home supportive services that's available. So, like family members are taking care of their elders, and that's a paid services that family members can be paid for. So it goes through your county and it's being supported. So work with your uh, social worker and your nursing case manager, so they'll actually support you in getting that information. um, I think that's all I had for this evening, and then I think you'll hear further from Sejal. Dr. Deshmukh, I just want to make sure that I have some references towards the end on the slide,
Yes.
and just a courtesy for all the pictures and icons and links that I use, so that I'm giving the due credit for the links that I have used. Thank you.
Thank you so much.
I'm guilty sometimes. I get angry. I speak negatively sometimes. But I think the more positive you give out, the more positive will come back. So I think your words are healing. And I think it's very important for us to use our words very positively to impact others as well as to impact your own self and forgive others. I think that's very key for our healing.
Yeah,
How's that, Veena?
thank you so much.